In way of introduction, I want to welcome everyone to Experience Care's Level Up webinar. My name is Peter Murphy Lewis, and today I'm joined by Cassie Poyer, the RCM and ERP support manager, an expert on all things Level Up, if not the creator of this platform. And that's why I've asked her to join us today to tell us about how this project came to life, all that you need to know about it, how our customers and non-customers can get more skilled up on this program. So thanks so much for tuning in. I expect today in the webinar that we'll talk about the series of free online training that you can get from Experience Care and that's been developed. But to get started, I want to ask Cassie about the 1,000 hours of research by the experts in long-term care. We calculated, if we added up the years, I think, Cassie, we calculated the years of the people who've worked on this platform to be over 275 years of expertise. So it sounds like a dinosaur, but that is fantastic in terms of learning. So just tell me a little bit, Cassie, about yourself before we get into Level Up. How long have you been in long-term care? How long have you been in Experience Care? And what was your role in this project?
Well, thanks for having me, Peter. So, actually, next month, November, marks my 20th year with Experience Care. And I started the company all those years ago in support and implementation. I actually was hired to do clinical support. And then I moved over to the RCM realm of things where I've stayed since then. Um, and because I've spent all that time in support and implementation, I was really keyed into and close to the training of the software, which we now call Net Solutions, over those many years. And so it was real helpful for me to be asked to help design this platform because I've spent so much time uh, in that implementation role. I'm incredibly excited about it. At the core, or at its core, the Level Up is meant to be an implementation tool. Or aid for facilities, assisting facilities who are new to our software, assisting facilities who may have turnover, who need some assistance in onboarding new clients, or rather new users, and teaching them how to use Net Solutions. So we're incredibly excited about it. And like you say, it did take thousands of hours and years of experience uh, of the team to get this going.
I remember almost a year ago, to kind of moving on to the origins. I remember almost a year ago when I first joined Experience Care, Cassie, Jason Long, our CEO,
Mhm.
talking about, hey, there's a staffing shortage. Our implementation staff cannot go into facilities and help them, implement EHR software, training, face-to-face training, even amongst MDS nurses and director of nursing is limited. How can we help? How can we help? And I remember Jason looking at me because I'm in marketing. He says, Peter, I think you can help with this. And I said, I think it's a brilliant idea. I think our support knows a lot more about how to help. So I know that I'm happy that you guys own this project. Can you tell me about its birth? Like, what was the first conversation? What was the first course you started working on? Were you guys thinking of tests? Were you thinking of just writing long blogs like SOPs and policies and procedures? Or did you know you were going to do videos from the beginning? Tell me a little bit about the brainstorming.
So we share a memory in that my memory was also that Jason, about a year ago, our CEO, thought this would be a fantastic idea to share out with our clients, and I absolutely agreed. And I also had a memory of it coming somewhat from the sales department, or knowing that sales was thrilled that we might be offering this. And it is true that though he did go to you first, you're certainly a great face for it, but we sort of relied on the experts in the client services team to record the data. So the truth is the client services department have essentially done the design, the prep, the editing, the recording of the videos. We do have development working on the actual website itself, which we'll get into shortly. And then from those videos, we were able to get the writing team. So, and I'll show you this, but the idea of each course is that we'll have a video, and then there's some written content um, that goes along with each video, and that team has also done a fantastic job. So it's certainly been a whole team effort, and again, thousands of
Phil,
hours.
if you'd like, feel free to show us what the homepage looks like. Those of you
Sure.
who are watching, you can go over to levelup.experience.care and check it out. But Cassie's going to show us what it looks like for first time visitors and tell it, go ahead and tell us about the first courses that you're going to be seeing. And then I'll ask you some follow up questions of who are these for?
Sure. So I believe you're seeing my screen now.
Not
We're
yet.
at the oh,
One
okay,
second. We'll see if we
certainly.
can get it figured out. Now I've got it.
Okay. So I don't know if it's been shared out yet, but the URL, the web address to get to Level Up is levelup.experience.care. When you go out to Level Up, you're going to see this as this is the homepage. And we've tried to make it incredibly easy here to know what to do next, to make it intuitive. So from the homepage, I have multiple options in signing myself up. I could start learning now. I could click sign up. If I have an account already, I could log in. But I'm going to go through a couple other areas first before I show the sign up. I want to show that if we click on that browse courses from the main menu, it does give us, it drops us down into where we've got all our courses listed. These are the courses that are available right now. We'll get more into this next bit, but each course is assigned or courses are assigned to roles. So when you sign up, you assign yourself a role, and based on that role, those are the courses that you'll receive. So we have examples here of all of our roles. If I wanted to see for a given role, if I'm curious what will happen if, as the MDS coordinator, let's say, what courses would that provide me? I could click here. It would show me the courses assigned. The other thing I want to just mention is that if there's any more confusion after this session of how the level up works, we have right here on the home page this how it works. Quick 6 quick steps rather on how the level up works. And then if I come down a little further than that, we even have some frequently asked questions, some facts set up. So we've tried to make it very easy on this website to get going.
Cassie, stay right there on the roles because I think that this is
Certainly.
pertinent to what you're showing. Back when the idea came about, those of you who are not customers of Experience Care, I think one of the most beautiful things about our community is we have these user group calls, and user group calls are people who want to use our software to improve their workflow and the delivering of their care. And they were asking for these types of courses. Can you remember what was the first course that you all started to work on, and what was the role that you wanted to solve this pain point for our customers at first?
It, uh, to be very frank, we have 7 people working on different types of courses. So we
Okay.
all started in a different area. And what we did is we took, because we've been implementing the software for years, we have training agendas and training guides. So we took that written documentation, created lists from there of what type of courses we want, and then from that we allow the client services staff to come through and pick the lessons that they wanted to record. So everyone started in a different area. Um, the one that I think we really wanted to get out there first was the ADT. That's sort of the idea to you have to have the resident admitted before you can do any billing or charting on them. So I would say that we started our main focus around ADT uh, way back when this began.
That's perfect. Is ADT finished? Is there a course that you can show us? And before you share your screen again to explore, I know I haven't tested this, but I've received this question in user group calls, and I'm
Mhm.
certain that you've tested it because you're a lot more thorough and meticulous than I am. Can you use Level Up on an iPad or a tablet or a cell phone?
Absolutely. Yep. You just need a internet capable device. So yes, it works on mobile devices, phones. It works on tablets. It works. All you need is internet and a device. It
Can
works
Okay,
across the
perfect.
board.
So will you show us in a course?
Yeah.
You pick a course at
I'm gonna
random that
pick.
you're proud of.
Yeah, I'm gonna actually switch over to a different screen real quick. I'm gonna pick physician orders. I think that's a pretty big one that our clinical staff user base would be very familiar with. So if you're seeing my screen, we should be
Yep,
looking at a
we
physician
got it.
orders. Okay. So here's the example of what a course would look like. Now, every course is going to be made up of lessons. In this case, physician orders has 9 lessons. We can see that the progress right now is that I have completed 0% of this course, but I'm going to show you regardless. So every lesson is going to, or rather, every course is going to start with a intro to those lessons. So I've selected into the physician orders. If I scroll through, it's going to outline for me what all the lessons of this order. Of what this course will be. It's going to talk a little bit about each of those lessons. And then at the bottom, it's going to list for me those lessons. And I would start at the top. So if I wanted to get into the first lesson, and if you allow me, I would like to show you what the lesson screen looks like.
Please, please.
I'm gonna click into the start lesson here on the very first one, adding admitting orders. It'll start with, and this is the bulk of it. This is what the client services have really been working hard to get published the last several months. I'm sorry, my internet looks like it's a little slow.
It's working
Here
now.
we go. It starts with this video. So there's a video here of this lesson. So this is a video. I think it's Neil Cox is the one speaking in this video talking about adding and admitting orders. So you can feel free to watch this entire video. That would be this lesson. At the end of every lesson, there's a quiz. But before we get to the quiz, I just want to point out, because they did a fantastic job, our content writers, we have there's multiple ways people like to learn. Some people prefer to be watchers. They want to watch a video. Other people prefer to read, or to uh, get their get the input in visually in that regard. So everything that's covered in the video is going to be covered as a written lesson as well, just beneath. You would just scroll through. It does include screenshots to pinpoint exactly where we are in that lesson. And so you have the ability to read if you don't want to watch, and you can scroll all the way to the bottom. And at the very end, it will let you know that you've completed this lesson. And next would be the quiz.
I have a question for you there, if you don't
Absolutely.
mind me interrupting. This looks like you've done very, very thorough work in knowing our support team, both you and Neil and Tanya and everyone. I know that you guys do good work. How much does this cost? It looks expensive.
um, this is actually free. This is free to not even Net Solutions users. This is out there on the internet. The only thing you need to do is get yourself signed up to use it.
Would you show us how easy that is, and then
Absolutely.
also transition into, if if I'm the owner of a facility of five different facilities, what happens if I just want to bulk import people, or if I want to see
Absolutely.
what that scoring looks like, so I can make my team make sure that they're making as much progress on the EHR that we've signed up for?
Certainly. Okay, I'll start with showing the sign up screen. We're back at the main menu, the main website of levelup.experience.care. And I click on the sign up button, and it's going to bring us up to an enrollment form. I do just want to point out, because if someone is unable to hit this session, we do have a sign up help link here. Clicking this gets me to some extra documentation that just walks them through how to use the sign up form and the Level Up platform as a whole. So I would simply fill in my information. I will just throw something in here. Mm, So I've got my first name, my last name, email. These are all required. I do have to set up a password, of course. So I'll type in my password and then confirm my password. And if I click continue now, it'll bring me to the second and last screen for the enrollment, which is facility name. This is required. This is important that we put in our facility name.
Hmm.
So let's go like this. And the next one, I do want to visit this facility number for just a minute. It's not required. We are expecting here your experience care facility number, which not everybody knows. It is located on the invoices you might receive from our finance department. And it's also located in Net Solutions on the licensing tab. So if you don't have it, that's okay. We can edit that in later. So the big part of the signing up is choosing your role. So as I mentioned earlier, we've got courses assigned to roles. So it's important that you pick your role, and you can do a multiple select here. If you find yourself to be the, let's see, perhaps you're the DON. Right here, and also you are the MDS coordinator. You would want to select both of those. So you would select as many roles as necessary for what it is you do at your facility. You would need to come down here and accept the terms of service, and then you would simply register.
Great.
What this does is this is going to send an email to the email address you just used. You would go into your email account and click on a link that you would have just been sent, and then sign yourself in for good.
Fantastic. Can you show me what it looks like from a supervisor point of view, or what it looks
Ye-
like in terms of progress of moving along in courses?
Absolutely. So once I've now logged in, um, takes a second here. I actually want to go to the dashboard. So now I'm logged into Level Up from where as a user.
Mhm.
I don't recall what role I have. We'll see that in just a moment. So I want to mention that first we've got the dashboard where you can see your courses in progress. So it looks like I'm in progress on my eDocs course. Here's all the courses assigned to me based on the role I chose. It'll tell me which ones are completed, which are in progress, which ones I haven't started yet. I'm behind on those ones. And then at the very bottom, it will show me the courses that I've completed. So thinking of from an administrative perspective, if I go into my profile, I'm able to see, first of all, I can change my personal information. I can edit here to change my name, my roles. And that's important because if you didn't select the role you think you need, you can always come in here and reselect and save. You can change your password here on the profile screen. What I want to talk about is that bulk invite. So we have something in Level Up called there are levels of users. So for a level up lead or a super user at your facility, you might decide that you want to assign somebody to be uh, the level up super user, and that they're going to control or have access to the entirety of courses for your facilities group. So that person can't sign themselves up as that lead. They will have to let us know in support, but once they get signed up, when they come into their dashboard, they're going to see this admin dashboard. And if we go there, and this is what Peter was directing me to, is this invite members. This is a pretty cool tool because once you can
Mm,
get signed in, you're able to, for your facility group, click on that invite members, and you can do a bulk invite where you're just typing in all the email addresses that you want to invite to sign up for Level Up, or you can just do a couple at a time as well. The bulk is kind of the one that we see being more used more often.
mhm.
And if you fill out all of the email addresses that you would like to send to and send, then Level Up will send emails to those people and invite them to come into that sign-in sheet form and get themselves signed up.
And Cassie, I know that the support team has helped super admins on board the entire team. The marketing team is more than willing to do this. I sent out an email about this Level Up webinar to visitors to our website, prospects, and to customers. And a lot of people wrote back and asked some interesting questions. One of them was, will you help me do the bulk invite? And I said, of course we will. So just reach out to Tanya or to Cassie or to anyone in marketing. We'll happily get on a Zoom call and show you how to do it and do it with you and hold your hand. But one of the cool questions that I received was, what is there some type of certificate? I know that my staff is going to want to put this on their resume and put this on their LinkedIn. Could you show me what it looks like when you finish a course?
Absolutely. That's the most exciting part of this, really, because we all want to see the completion. So from where I'm logged in here, I'm going to go to the dashboard, which is going to show me again all of my courses, including those I've completed. So if I come to the very bottom, it is going to show me any of my completed courses. I just have the one. But if I click the button to go to the course to download my certificate, and I can come to the bottom of that course, which by the way is showing me that I've completed it 100%. I can there's an area here at the bottom that shows that I can download my certificate. So if I do that,
Fantastic.
you're able to print this out or to submit it to your facility lead, however, whatever your course of action is for it. And we've got Jason, our CEO's signed off on it for you.
Yeah, I remember when we showed kind of a beta to this to some of Experience Care customers, I believe in April or May. One of the administrators said, "Can I have a certificate? I know my team's going to do it, want it." So I'm really happy that we put that together. That's beautiful and that's encouraging and inspiring for some of the users to continue using the software. Another question that I received back from someone over email yesterday was, is there anything for the financial side of our EHR suite, software suite?
Yeah. So when you say financials, I'm picturing APGL,
Okay.
accounts payable and general ledger. We have started with some AP courses. They are out there. We're the next step is going to be our GL. So yes, and beyond that, for our accounts receivable users, we've got a series of courses set up for accounts receivable as well. And as you can see right here, we have resident funds courses. So we're not 100% across the board complete with all of them, but we do have AP funds, AR. Uh, ready to go, or some of the courses within which ready to go, we are still working, or yeah, we're still working on the general ledger.
Great. I think I can answer this question, Cassie, but I see that someone who's watching the show named Julian asks if he can download some of the documents to keep on his files. I'm assuming he's asking if he can download some of the courses, and I think the answers to that is we're keeping everything online because the support team is updating the courses as our interface changes, as there's changes in regulation. Is that accurate?
Yes. So for thinking of looking at a lesson page, the video and the written content is not downloadable. You do have to access Level Up to see any of that. So yes, it is accurate to say that it is not something that you can work on offline.
And in terms of knowing which course to start with, if I
Um,
choose my role, will Level Up pretty much give me advice on which should be my first one?
Yes, in terms of that, when you've got your role, it's going to show you your all the courses. It doesn't say to you, we suggest you do this one, then this one, then this one. There is an expectation that you and your role know what you do most often. So if you are, let's say, somebody on the charting staff, and you've got physician orders and point of care and IPN all showing here in your catalog, I'm going to let you decide if you use POC more often than IPN. That's probably where you're going to want to start. So the system doesn't direct you any further than just assigning you based on your role.
And I know that there's going to be some users that are a little bit intimidated. Is this really hard? Can you take the tests and quizzes twice, three times? How helpful? How easy are the questions?
Okay, I'm glad you asked that because we haven't covered quizzes yet. So let me pull one up. You can take quizzes. You can revisit any of this content multiple times. So even though I've completed e-charting, I could still go back in and re-review the e-charting lessons if I'd like. If I pull up when I haven't finished yet, so here's e-documents, I'm able to I'd have to review. Let's see. I would have to start the next lesson, which would take me into the um, lesson itself. I can jump to the quiz and get to the quiz. And if I did this right now and failed it, and by the way, pass rate is 80%. So we
Okay.
expect that you get 80%. The system calculates that for you. If you don't pass, it'll offer you right there on screen a button to retake the quiz, and you can take that quiz as many times as it takes.
Okay.
We don't even track how many times you've taken the quiz. It's just you'll take it until you feel comfortable enough with the content that you can pass the quiz. And I would like to mention just right quick that this is a two-lesson course. This one is after we've passed each lesson in terms of each lesson quiz, there is a final exam to pass the course. It's going to be lots of times you're going to see repeated questions. So just kind of taking a cumulative effort of all of the individual lesson quizzes. As to how hard are the quizzes, we're not trying to make this isn't SAT levels of question and answer. They're going to be pretty simple, pretty
Mhm.
direct to what it is you've learned, either by
Okay.
watching the video or reading the content.
Okay, I see another question. Thank you to Julian and thank you to Vladislava. Vladislava is asking that she's curious if she can sign up for more than one course at one time. I'm guessing she's asking if she could be taking two courses and studying for them at the same time.
You bet. And so here's how that would look I if they go into their dashboard, they would see all the courses here. So I've got one in progress. I've got three not started. I could absolutely start this IPN course right now, and it would just show me as having two in progress. So absolutely, you can jump around. If you want to take a break from one set of lessons to go to another course at its lessons, you can absolutely do that. There's no time limit. There's no time frame. You can have as many courses open as works for you.
And I know currently the courses are aimed at experienced care clients and customers, but I've heard the director of success talking about some courses that he's going to make for owners, operators, and even non-experienced care courses. Have you heard what's in the make and what can we expect in the next 6 months for non-experienced care visitors?
I understand they're trying to put together some content around PDPM and reimbursement and the best ways to increase reimbursement at facilities, and that's to come. As for a timeline, I believe I think you just said 6 months. That's where I would have put it as well in the next 2 quarters, rather 3 quarters. We would expect to see some of that type of content out here on Level Up. But I think, as you just stated, it is accurate right now. It is. Uh, what's published right now is specific to the Net Solutions course and only that, though those are coming.
Great, fantastic. I think that there's some more questions coming in. If not, I have some prepared that I've received over email. I'll
Okay,
see if
great.
our host Victoria is going to share any on there for us to for any of those for us to field. Otherwise, I'll go right into it. In the meantime, the one that I oh here's another one coming in from Angela. She's a licensed nurse. What course would we recommend? What course would you recommend that she start with?
Well, for one, when Angela signs up, I would make sure she does use that role. She said licensed nurse. I would make sure that that's the role she chooses. And for those clinical type roles, it's going to primarily be all of our charting software. So it's going to be physician orders, point of care, e-documents, e-charting, interdisciplinary progress notes. Eventually, when they get up there, resident assessment care plan. Those are all going to be the types of courses she would expect signing up using a licensed nurse as her role.
This is a really good question that I got over email. And I'm sure other people are thinking the same thing is, do you take these courses in real time with other people? And does that mean that you're going to need a camera and I'm going to have 25 peers from around the US looking at me when I'm taking this course at 5 o'clock in the morning without coffee?
So, right, is it live instructor led? First of all, I wanna say, we would be thrilled if you took a selfie of yourself taking some of your Level Up, content and sending it in to us. We would love to see that kind of, that type of photography. But no, no cameras required to use Level Up. It is not instructor led in that it's some live session. It really is just on your own. You sign in when you have that time and work through your own course load.
Ooh, Vlada got me with a question that I can't answer, and I'm embarrassed, but I hope you can save it. She's wondering if we need to use a certain browser: Chrome, Edge, Firefox, Safari.
Sure. So we've designed Level Up to work on the same browsers we would use for Net Solutions. In the Windows environment, that's generally going to be Edge and Chrome. We've not tested it robustly on Internet Explorer because Windows is sunsetting Windows. I'm sorry, Internet Explorer. And I don't use Apple products myself. Is it Safari, the
Yeah,
browser
Safari.
to the?
Mhm.
Yes, and it will work on that as well.
Okay,
So the main
great.
browsers you would
I,
expect to
I
see.
see another question. I think we kind of answered this. If Julian's asking if he fails a test, can he retake it? I believe that he can as many times as he likes.
That is accurate. Yes,
Okay.
many times
Uh,
as it takes.
Okay. And Julian, if you're like me, and this isn't a joke, I am dyslexic, so it does take me a while. So that's a relief for me, Cassie, that I can take the test 10 times. And as a side note, Cassie, I don't think I've told you, I signed up for my CNA training today. So on November 1st, I'm starting my CNA training. So I will have to go through level up training as well eventually.
Congratulations, that's very exciting.
Thank you.
Yes, so if you have any questions as that comes about, let us know.
All right. Let's see. Angela's how long does it take to finish a course? Do courses take 5 hours, 10 hours, 15 hours?
So it's a great question. It's a tough answer because every course is going to be a little different. For example, some of our AP courses, there's not much to know for every little lesson. So it could be anywhere between a 2 to 5 minute video. Some of our courses are going to be a little longer just because the bulk of the information that needs to get passed through. Also, as you can see here, that our courses have different amount of lessons. So IPN has 6 lessons where e-charting only has one. So I would tell you roundabout, it would take anywhere between 20 minutes to 60 minutes to complete. Well, it's not now. Uh, Likely less than 20 minutes for every lesson. Many courses between 20 minutes to 60 minutes.
Okay. I got this question twice over email. There's a chance that it'll come in on chat. Says, and I hope you can answer. I hope you can field this because I can't. It's talking about 1099 processing.
Oh,
Is there a lesson about 1099 processing?
yes. Okay. So the great question. I'm glad you asked. We did just complete the recording and the written content for the 1099 processing using our accounts payable. It may already be up here. I don't think it's actually been uploaded. It will be up any day now if it's not already up there. I would also just note for anyone watching that this is for our accounts payable and payroll users. Our order desk is now open for the 1099 and W-2 forms ordering. So that's open. Let us know if you need any help with your forms. And that's important, Peter, because it's a very timely issue. It's sort of an end of year. 1099 processing is an end of year issue.
I think those are all of my questions, Cassie. You've done a fabulous job of introducing what a robust online training program is. I think that if I were to highlight a couple items, and I'll ask you to see if there's anything that I've forgotten, I want to highlight that this is free, free for all clients of Experience Care. EHR, Net Solutions users, it's free even for non-experience care visitors to come check it out. We will have more classes on there for unrelated to our EHR to help you deliver better care. The most important thing I think in terms of getting acquainted with it, Cassie, is One, sign up. You can do that in less than 45 seconds. Choose your right role, and then the system will tell you what courses you could start with. If you are a super admin and owner, administrator, and you want us to help you and you don't know how to start this, just reply to the emails that we've sent you, call into our tech line, call into our support line, and Cassie or someone on her team or me or someone on the marketing team will help onboard you. Is there anything that I haven't mentioned, Cassie, that you'd like to highlight?
You've got it all. I do just want to show everyone real quick that if you do need to access us or you have questions for us, here on the Level Up page, you can click on the support link at the top. The phone number is listed there, but the support link itself will take you and show you the email here on the website to contact us and the phone number. So please let us know if you have any questions. We're here to help.
Fantastic, and I am particularly excited about the feedback. I think that I asked you yesterday when we were preparing for this how many people signed up, and you said we've had over 500 or so.
Yep. Hmm.
And this went a little bit viral. We made about 3 weeks ago, we put out a blog about this webinar, and Yahoo News picked it up. So we got a lot of visits to our website, a lot of visits to the blog, a lot of comments and feedback from people who are not even experienced care users. So thank you all for
Wow.
participating. Thank you, Cassie, for joining us. Thank you all for your questions, Julian and Vlada, and look forward to seeing you on Level Up and passing those exams.
I thank you
Bye,
very
guys.
much.